Thank you, Mr. Chairman. I was hoping that Senator Hatch would be here, and I just wanted to take 30 seconds to say, as critical as this situation is, and I view it as very critical, I also view the situation in Puerto Rico very critical. I would hope that our colleagues would work hard to make sure that there is a federal FEMA declaration for all of Puerto Rico, every county, and I would hope that our colleagues would work very diligently to encourage the White House to appoint a lead at the White House, perhaps a czar, to work with all federal agencies in coordination. I know Senator Hatch cares a lot about the health care issue, but these are issues that are going to take a long time for us to recover, and I hope our colleagues would work to encourage such coordination at the White House level. Thank you. On this subject, I'm having a tough time understanding the overall philosophy of this legislation. I can say that I definitely had town meetings and was encouraged by the fact that Senator Cassidy wanted flexibilities for states. I was encouraged, I think I even mentioned it, that he wanted flexibility. But the reason why we're not working together now on this legislation is because it is taking the premise of flexibility and turning it on its head as it relates to a program that has been a 52-year relationship between the state and federal government. It is taking a 70 million population and basically saying, I'm going to change the way healthcare is delivered to you under the ruse that you are trying to address the individual market, which is 19 million, 18 million. So you are trying to say to people, I'm fixing that in the individual market, when you're not. Premiums in states that expanded Medicaid have 7% lower premiums in the individual market. And the notion that we should do this because of TANF, that TANF was some sort of lifeline, the TANF experiment, which I should bring up, your state is the lowest in the nation in per capita TANF benefits, in the sense of for every for every 100 people, you serve the least TANF benefits. What has driven people out of poverty in America is not the way we structured TANF. It's the EITC. It's the SNAP program. That is what has helped. And so now to take this block grant experiment and say that you are going to somehow magically drive down costs in health care, when in reality, you are just kicking millions of Americans off with the ruse of putting them into a capitated program and then cutting their benefits. So to me, it is not a panacea for the future. I would love to see, oh, by the way, you take the one creative, flexible idea that states have, Section 1331, that has allowed 650,000 people in the state of New York to get cheap, affordable health care at $500 a premium, and X'd that out. So you took one of the most creative ideas that will cost New York billions, probably $3 to $4 billion, because you've X'd it out. So my point is this to Ms. Miller. I'm pretty sure there are innovative ways in the Affordable Care Act to drive down costs. I'm pretty sure your state, Pennsylvania, took advantage of them. I think you helped expand a program to get people off of nursing home care into community-based care. In our state, that saved billions. I'm pretty sure that probably will save a lot of money in Pennsylvania. What about those ideas in driving down the cost of Medicaid? Because my colleagues on the other side, I think, seem to think the only way that you can drive down the cost of Medicaid is cutting people off. And I totally disagree. In fact, I think the chart that raises the question on rural health care is how many people in the hospitals in rural America, the non-expanded states, have seen the most closures of rural hospitals in America. Why is that? Why is that? So the notion that somehow we have in the corner of Graham-Cassidy figured this out, I just don't believe it. So do we have innovation in the Affordable Care Act that is driving down cost in the Medicaid market in a very significant way, and can we push it faster?
Thank you, Senator. I think you're alluding to our Community Health Choices program that we are rolling out. I think we all know that seniors want to be served in their communities, and I think our governor has made a real push to to get people out of nursing homes and let them age in their communities. And we also know that in terms of the cost to Medicaid, it's mandatory in terms of paying for nursing home services, but community-based services are not mandatory, and yet moving people out of institutions and into the community is how
Thank
we're going
you.
to save money for both the
Thank you,
state and federal
Mr.
government.
Chairman, thank you.